My name is Dr. Rick Iarussi, and I am a board-certified anesthesiologist by trade. And I have 31 years of practice under my belt, and over that 31 years I've done a bunch of different things and worked in different environments. So throughout that whole time I've done a lot of spinal injections, spinal anesthetics, epidurals. I tried to count one time, and I think I probably have about 30,000 procedures under my belt. For about half of my practice, I did some pain management as well. When I came to this area recently, I decided to concentrate back on the anesthesia part and stop the pain management, but I have several years of pain management training and work under my belt as well. And when I came to Toledo, I started doing ultrasound-guided nerve blocks, and we do a lot of those for operative procedures, and that's where I gained some expertise in learning how to find nerves via ultrasound and then do injections around them so that patients could have pain relief after surgery. So those avenues through my 31 years led me to develop an interest in biologics and regenerative medicine. I'm specifically interested in a few areas of biologics and regenerative medicine, specifically peripheral neuropathies, patients with lymphedema, and patients with reflex sympathetic dystrophy, as well as patients that have either traumatic brain injury or conditions like multiple sclerosis that affect the spine and are mediated by factors in the spine. So I went and got some training. Went to a course in Philadelphia put on by Boston Biologics to learn about whether I might be able to do biologics and regenerative medicine using stem cells to treat these entities. Typically, stem cell injections revolve more around joints and musculoskeletal problems. But throughout 31 years of practice, I noticed that patients that had things like peripheral neuropathy and lymphedema, we in traditional medicine had very little to offer them. And so I developed some interest in finding maybe a way to help manage those patients and treat them, potentially using stem cell. And sure enough, when I went to the conference, there were some physicians that were treating those entities with stem cell regenerative medicine injections, and that's how I developed my interest and got started in this type of practice.